streaming audience, and I am really excited about today's discussion on aging life care. Let me welcome our panel members, and I also want to make sure that let me, and panel members, before we get to know you, I want to make sure that I uh, share an important slide here because, folks, one of the reasons that we are doing this is it's sort of a grand buildup to the upcoming Mid-Atlantic Aging Life Care Conference that is in November in the uh, DC metro area. And are you all seeing my screen yet?
Yep.
Yes.
Okay, good. So what I want to spotlight is the main sponsors. There's many sponsors and exhibitors at this event, but I want to give a quick shout out to Inspire Embassy Row, Beverly Assisted Living, the Fitzgeralds of Palisades, of which I'm going to be going to later this afternoon, and Kensington Senior Living, Advanced Nursing and Home Support, and Graceful Transitions. I'm going to make sure to add links into chat to all of these organizations for y'all to get in touch with them. But we are very grateful to these organizations for supporting the conference, and we're excited to put them in the spotlight as we do these monthly roundtables leading up to the November conference. So, all right, now that we're done with that, we can jump into the discussion. And what I love doing first is getting to know our panel members. Heather, how about if I start with you? Tell us a little bit about your background and what led to you being an aging life care manager.
Thanks so much, Steve. I'm Heather Suri. I own a group practice called Pathways in Aging, and we have offices in Northern Virginia and Seattle, Washington, which is where I am originally from. I am a nurse, a registered nurse by training. I don't know, I stopped counting at 25 years, but it might be 26, 27 now. And always worked in community settings. Had a big chunk of my career as a certified hospice and palliative care nurse, and found, like a lot of us, you know, every role that I was in, there was so much more that needed to be done than what I could do in that role. I actually thought I invented the profession of care management when this idea came to me that I could do all of these other things. And I thought, why isn't everybody else doing this? And it turns out they are. I stumbled upon the Aging Life Care Association, and the rest is history.
I love it. All right, Erin, yeah, I'll put you on deck next. Tell us a little bit about your background.
Thanks for having me, Steve. I'm Erin Kershaw, the owner of Brandywine Eldercare Management. We've been in business for almost 14 years now. And like Heather, I am also a nurse. My undergrad degree in nursing, did a number of different things when I was a nurse. I was inspired to go to grad school in my 40s and pursue a master's in long-term care administration and a certification in gerontology to get into this field after observing the challenges that my parents had trying to support family members who were older and long distance. And that really opened up a great opportunity for me to learn about the Aging Life Care Association and get involved with this organization of people.
I love it. And last but not least, Susie, you want to tell us a little bit about your path and your background?
Sure. I'm Susie Elder Murphy. I'm the owner of Aging Well Eldercare, and our company will be 36 years old this November 1st. I've been with the company for 31 years and owner since 2013. And I sort of come at this profession from a slightly different direction. I was fortunate enough to grow up with all four of my grandparents, and they were all very active, positive role models for aging for me. And I blessed to have my parents at age 92 and 93 being very active elders and active grandparents and great-grandparents. And so I was always more looking at the engagement side of things, and met Deborah Levy, the founder of our company, and thought this would be something I could do while my children were young. And little did I know that 31 years later, I would still be doing it. Our team serves the Metro DC area, so Washington, DC, Montgomery County, and Frederick County. And we have a team of nurses, social workers, gerontologists, and we just hired an occupational therapist. So we're very excited about that. My background is as a certified care manager.
Great. Okay. And Susie, I'm going to come back to you in a moment. We're going to talk about what is aging life care. But before I do that, so you just shared you're based in the DC metro area. And then Erin, the geographic region that you serve is
We are suburban Philadelphia.
okay. And then Heather is DC metro and
Northern Virginia. Right now, we're not going across the river, so we're in
okay.
Northern Virginia, and then the greater Seattle area.
Greater Washington. And before because I don't want anybody from Southern California jumping off this call, I want to share something real quick, and then I'm going to have Susie kick off a definition of what aging life care is. But I want to well, this is the Mid-Atlantic website, but I'm going to share both of these. But what I want to share with y'all is this is the aginglifecare.org website. All you got to do is click on find an aging life care expert, and it'll bring up a very comprehensive search tool. And so you can type in any zip code that you like. And let's see, well, here's one from sort of the Baltimore area, and I am going to click find, and then it will bring up members and where they're based in the region that you're selecting. So folks, if you hear us talking today because somebody asked a question about something in Northern Virginia or in Philadelphia or in DC, I want you to be open-minded. We're talking about elder care globally. Okay. Oh, holy cow. And Jonathan is from Southern California. I just threw that out as an example. Okay. All right. So now, Susie, kick us off with, especially for those that may be tuning into this, who've never heard of this profession before, what is an aging life care manager and aging life care? And then Erin and Heather can add to that too.
Sure. So at Aging Well Eldercare, we say we're like wedding planners for aging well. So when you're planning a wedding, there's lots of different things, the dress, the venue, the person performing the ceremony, all kinds of things, and you don't know who should you call, who would be the good photographer, videographer, music, all of that. And so an aging life care manager is an expert in all of the different services and supports and referrals that you might need as you're going through that aging process. So referrals to elder law attorneys, estate attorneys. What's the difference between an elder law attorney and an estate attorney? We're doing crisis intervention. We have actually 8 different knowledge areas that we touch on in our work. And we're unique in that we are interdisciplinary. So a lot of people conflate case managers with care managers. And a case manager is typically somebody you're assigned in the hospital or by your insurance company, and they're focused on really a very narrow path. Either you're in the hospital and they want to get you out, or you have an illness and they want to help you manage your diabetes, but they're not looking at your psychosocial support or other aspects of your life that you might be having challenges with. And as Steve was saying, we all do the same kind of work, but we're geographically specific. So I couldn't really offer the resources in Southern California that person needs, but maybe they have a relative in this area that they're looking for support for. Or likewise, if you reach out to one of us and your aging relative isn't in our service area, we always try to find the right match for you. So we would refer you to an aging life care manager in your area that fits your need. And some of our practices are a little more nursing oriented or social work oriented. So there may be individual needs that you're looking for in getting the advice you need for someone or for yourself.
I love it. And I'm dropping in the 8 knowledge areas into chat there. I also dropped in the definition of aging life care from the website for folks that might be interested in that. But Erin and Heather, anything to add to the profession?
I think something that, and out of all of us, my practice has been open 7.5 years. So I'm the newbie on the panel today with Erin and Susy. But some of you might be familiar with the term geriatric care manager. I came into practice after we were called aging life care managers. So I wasn't there during the geriatric care manager era. But I think it's a really important distinction because though all of us across the country have a high level of expertise in aging, a lot of us are starting to do more work with people across the lifespan. We might have someone in their 50s with an early onset diagnosis of Alzheimer's or Parkinson's. We might have a stroke survivor who is in middle age, or a younger person who maybe had a traumatic brain injury. So I think that aging life care manager opens up the populations that some of us are working as these needs to navigate the resources in the community and the healthcare system become more apparent.
I love it. And I also want to just remind our audience, one of the best things about these discussions is they're live and interactive. And so you can ask questions, and those questions of our panel member, those questions could be a caregiving situation you're going through now. It could be something that you observed. You could have maybe worked with an aging life care manager, had an interesting experience, or you could be a professional and you've got clients. So don't hesitate to use chat or Q&A. But don't worry, I can keep going here with these 3 for the next probably day in terms of questions. And actually, I'm glad I did that. I've never had this question. Paula, you get a gold star. And Paula asks, how many clients can you have at one time? It's a really good question. I just learned not too long ago that a physician that I'm good friends with, he sees 32 clients a day. I mean, I was just like, holy cow. But I've never had that question. Would any of you care to answer? How many clients can you maintain at one given
I
time?
think you'll get 3 different answers.
Yeah, that's why I'm interested. Yeah.
For our practice, we run a full-time salaried model for our care managers. And so for us, about 20 clients, we consider a full-time caseload for an aging life care manager.
Yeah, and knowing some of the cases or hearing at least on these venues, some of those cases are daily interaction. Others can be, more kind of crisis or planning focused. Really good, Heather. And Erin, any thoughts that you'd like to share on kind of the definition of your profession and things that you've seen there?
Yeah, and I think, and that's not an unusual question that we get. And my answer is a client, not every client is the same. We have some clients that have really significant needs and need a lot of our time, and then some we may see quarterly. So we usually, our care managers have a mix of some of those more intensive need clients, and then the ones that are very nice and stable, or the proactive, and we can see them less frequently. I think the important thing for all of us in this field, and I'm sure Susy and Heather would agree, is that we have the bandwidth to respond to our clients if something urgent comes up. We have to make sure there's a policy in place so that we're not stretched between two different clients at the same time. The expression that we use is the rented daughter with expertise, sort of the wedding planner. And I think because it's such a comprehensive field, we can really fill in the gaps, or in some cases, when we have clients who have no real family members or support system, and then we are filling that role for them. We're doing everything from, attending appointments to helping locate senior living communities and following them after the move, continuing with that relationship. We work with clients through end of life. We tag team with family members and good friends when they're available. But we want to be very proactive and not just look at what the needs are now, but help them plan for what's coming down the road.
All right. You know what? These questions are great that are coming in. They're coming in fast and furious. So I'm going to sort of handpick a few, and I'd love all three of you to comment on those. But Burke has another great question. And it's how, oh gosh, they're coming in so fast. I just lost it. It's how many people do each of you have in your respective businesses? If someone leaves, can you have someone else take over the case? And I tell you what, I've been around, in this field for 30 years, and this used to be the type of business, and it's still, there's people out there that just are hanging up a shingle, but it's really evolved to where you all have teams and backup. But can you comment on that?
Yeah, I'm happy to comment on that. So we have a total right now of 32 employees, and that includes 14 care managers, office staff, and then we have our Debbie's Angels that are more the social engagement. But we all use the same database where we share all the information about the clients, and we share backup and on call. So even if you were to call on a Saturday and somebody who's not your care manager is on call, you don't have to repeat your whole life story. It's already in our database, and they can just pick up right where your care manager left off. And the way our database works, it's also very seamless. So if any of our staff are on vacation or have a family emergency, seamlessly we can jump in and help out with what you need. I realized that was one really important point that I meant to make in terms of who are aging life care managers, and that is that sets us apart from other people, which is that we do not have a financial relationship with any resource that we recommend. So we're paid by you to give you the best advice for you and your situation. And for a lot of people, when we explain it to them, they really appreciate that. They know that our advice is going to be the best advice for them and their situation, and we're not getting any referral fee or even a Starbucks gift card or anything from any of the resources that we regularly recommend.
Yeah, thanks for that. And Erin and Heather, you want to kind of add on? I'm assuming you have sort of a similar system that Susy has, but speaking to the fact of if somebody leaves, or that how that works.
Yeah. Do you want to go first, Heather?
Well, no, you go, because I have something I want to share about kind of the larger organization. So you go.
Okay. We have 7 care managers and 2 thoughtful engagement specialists. Just like Susy said, I'm sure the same thing with Heather. We share a HIPAA compliant database, and each client is assigned a primary care manager, but we always have others available if someone is on call, or on vacation or unable to take, where we can share that information. And again, you don't have to repeat anything. Someone will be familiar with your circumstance and will be able to step in. We're available 24/7.
And our practice is very similar, but what I find striking about this, and I think really the umbrella for all of us, is the Aging Life Care Association. We have a published code of ethics and standards of practice that we are all adhering to, that really helps us put into place these business models and these service delivery models that are reliable and that are meeting this high standard for professionalism and for ethics. Our association nationally, last time I checked, and Susie, you tell me if you've heard anything different, is still about 60% nationally solo practitioners. 40% of us are part of group practices. That trend is shifting, like Steve said. But the really cool thing about the Aging Life Care Association is that there are fantastic resources for solo practitioners. So if they don't have someone else in the practice, they're partnering with other care managers. They're getting some great guidance and advice for how to set their practice up so that they can meet the needs of their clients. So we all look a little different in how our practices are structured. But again, the benefit of working with someone who is a member of the Aging Life Care Association is that you've got a pretty good sense that we're going to meet a very high standard of professionalism, regardless of how we're structured.
Now, Erin, you said something that struck a chord with someone, and I heard you say it too. But Burke says, "What is a thoughtful engagement manager?"
Thank you for asking. That is a program. It's a one-on-one social enrichment program for people who are isolated or who are struggling to get integrated into a community, or who have a cognitive impairment that keeps them from really having a lot of enrichment in their lives. So those two specialists work one-on-one with our clients. Some of those are our care management clients, and some are strictly thoughtful engagement clients. So that's a social program versus a care management program. Happy to talk more about that. Feel free to reach out.
Yeah, and then I think that's somewhat similar to Debbie's Angels at Aging Well. And Heather, what do you call it in your organization?
So I don't have a structured, thoughtful engagement program yet. That is a goal for us. We see it as a gap in the community, and I think a lot of care managers are seeing that it's a gap, and that's why they're starting these programs. And I think that as professionals, we're uniquely positioned to offer those types of services in a really high quality way. So stay tuned, Steve.
Yeah. But somebody asked, because when I put up the 8 areas, and I'm trying to find the question, but they said, so I'm assuming that maybe some practices may specialize more in one area or the other. And earlier, Heather, you had talked about some practices are expanding beyond older adults. Y'all want to just comment on that a little bit, but you actually just illustrated the fact that this is an area in your practice that you haven't developed yet, whereas Susie and Erin has, and it just lends itself also. And I know you all recommend this, folks. If you're interested in hiring an aging life care manager, it's not a bad idea to call 2 or 3.
Oh yeah. Mm-hmm. Yeah, and I think a trend that we're all seeing, and I think industry-wide, we are very happy to see this, is the younger retired people or about to be retired people who are looking to kind of understand what the options are, what the prices are. We call it proactive planning, but I know there are a lot of different terms that are reflecting that same thing, working with healthy adults who want to get some sort of structure in place, want to know what their options are. And then if necessary, because there are wait lists in a number of communities, kind of do that investigation early. We like that because it gives us a chance also to get to know them. They get to know us. We have a relationship. Then over time, if there is a need for active care management, that's pretty seamless to transition.
Okay. Now I want to get this one out. I want to thank the two or three people have asked, Erico and Roberta are asking about how is aging life care paid for. But before I get your response, I want to read Wilma's comment where she said, our experience with long-term care insurance, the life care manager's expenses were not covered. It wasn't until our family member entered a dedicated memory care community did long-term care insurance start paying. We had about a year and a half of a care manager working with us before we made the move to memory care. Let's talk a little bit about cost payment, and Wilma also opens up a whole great way that people are working with aging life care managers. I'll let you guys take it away.
Now, those policies are all different. And they're increasingly challenging to work with because I don't think anyone who wrote these policies back in the day thought they would be doing the payouts that they're doing now. So, it's often tricky to navigate to get that. There are some policies that do have reimbursement for care managers. There are some policies, but you have to use their specific company. There are some policies that have no reimbursement for care management. So it really is important to read your policy. And that's something that people hire us for, is to help them understand their policies and how to get the most out of them.
Great.
Yeah, I would agree with Heather. Every policy is different. We have a client right now. It's not a lifetime unlimited policy. It will only last 999,999 days, literally,
At
like
all?
that's written into the policy. And so just like Heather, we help clients who've already made that investment in the policy, been paying on it for years, and then, is now the time that I can use it? What do I need to show? And then also we have people who hire us when their long-term care insurance stops paying or they're having difficulty opening a claim, advocating for them and helping them make use of that tool. Because this is money on the table, and unless you have a policy that your spouse could inherit if you predeceased them, typically it's just going to be money that's left on the table. So we encourage people to use that first before other assets.
And so aging life care, there are some your aging life care. I mean, Medicare or Medicaid doesn't pay for it. Does health insurance ever pay for it? And it sounds like long-term care insurance generally doesn't pay for it. So the maybe sometimes, but so in essence, this is a private pay service for most of your clients.
There's some grant programs that cover some care management services. In this DC metro area, the Senior Living Foundation for the American Foreign Service is one that I know has some grants available for either the aging parents of active Foreign Service officers or retired Foreign Service officers. And then we see that in other states too. There's some hyper local, sometimes grant programs, but largely it is a privately paid service. I'd love to hear, Erin and Susy comment though, because this is true for us. Yes, there is an out-of-pocket expense to work with us, but we save people money, a lot of money. Erin or Susy, do you have a story to share?
I just wanted to add that we've also had some employee assistance programs cover our services, and that's always worth looking into. If you have an older loved one or a loved one that needs some help, it's possible you could go to your employer and get some coverage for that. And we have had some long-term care insurance coverage policies from just a limited number of hours to some pretty significant coverage, I'll say.
Yeah, we have had the same. We work with the Senior Living Foundation, and I think the most I've seen, we've had clients that had $7,000 a year of care management that would be covered by their long-term care insurance. And on the other end of the spectrum, there was a policy, $150 in your lifetime. So, which is basically about 1 hour of service. People have asked specifically about what our charges are. Our charges for ongoing care management is $190 an hour. And then we have a different rate for our office consultations or Zoom consultations that we do with families. And typically we provide a letter at the end of the year with all of the charges that have been paid for care management that can be deducted as a medical expense on taxes in consultation with your tax accountant or whoever is helping you prepare your taxes. But like lawyers, we bill anyway at Aging Well Eldercare in 6-minute increments. So you're not paying for a big block of time that you're not using. So whether it's a conversation by phone or we're in your home, you're only being billed for the amount of time that we actually spend with you.
Okay, so now I want to, William has a very specific question, but we could make it very, very general. And he says, can you recommend a resource to identify primary care physicians who have expertise in elder care? Now, he happens to be in the DC, Northern Virginia area, but I'm curious, like are you able to help people? Because he talked later about how he's just not getting treated the way that he'd like to be treated by his personal care physician.
We have a shortage nationally of board certified geriatricians. And that is often what people will Google. And there's some of them out there. Can be hard to find some who are taking new clients, but your local aging life care manager will know who's good in the community. And sometimes we know we're working with someone who might not be a board certified geriatrician, but we have found that they take time with our older adults, that they're skilled prescribers and de-prescribers, that they're more holistic in their approach. So we tend to have an idea of who's good and who's not, and we're team builders. So that's a primary function I think that we all offer, is helping people find the right providers.
Yeah.
Yeah, I
So
think it's, sorry.
no, go
I was
ahead.
just gonna say, I think it's really a challenge for all of our clients. They have some of their favorite providers who are retiring or leaving the practice and going into concierge practice. It is difficult. We hear this all the time of our clients trying to find the right providers. But the good news is, yes, we generally have some relationships with providers who have given good service to our clients, and we can reach out to them sometimes and get some ability to get our patients seen. Certainly not a guarantee, but we know which ones, if it's this one or that one, either logistically we know what may make more sense, or because of our particular client's diagnosis, we may know which provider would be the best suited to provide that service.
Yeah, and one of the 8 areas is advocate, and so William, maybe a strategy might be reach out to a few aging life care managers in your region and talk to them about being an advocate for you, because maybe and this is also a great thing to happen. None of us have a crystal ball. We all might land in the hospital one day, and having a aging life care manager that you've got a relationship with, or a patient advocate, that you or your family can call, and it's like, hey, I'm in the hospital, I had a fall, helping you navigate the system. It could be done with your doctor's appointments too.
I would also add, Steve, in the Metro DC area anyway, there's really a surge of home visiting practitioners of different kinds. And so that could be for somebody for whom it's hard to get out to the doctor, but also for somebody who's busy and maybe working from home and having somebody come to you rather than you going to them. There are a number of practices that are really expanding in that area, which I think is a
Okay,
nice trend.
I want to address Judith's question, because it's under the umbrella of what I refer to as solo aging questions, and I'm always referring the folks that identify that way to aging life care manager. And Judith says, if I have no local family and I need surgery, what would you do and how would you charge? And I know we're talking in generic, and Judith, the key is calling some colleagues of or calling one of these folks if they're in your area. But I'd love to hear your response on Judith's question. So she's typing this in and it's sort of like, hey, what if I needed surgery? How could you help her?
I think we all have these proactive programs. I know all three of our practices do. Mine is called Plan Ahead with Pathways. And so we have a lot of solo agers in that program where before the surgery, well, before we need to be talking about that, we've already built a chart. We've got all of your legal documents. We have talked extensively about your values, your preferences, what you want, so that we are prepared to advocate for you when that surgery happens. So, we do a lot of pre-work so that we're ready to go with that what if. And for us, we have a flat fee for our program, that standalone Plan Ahead program. And then if someone needs a care manager to jump into action, we bill at our hourly rate.
Okay. And that Catherine had that very question. She said, how are costs structured in these situations? And that seems pretty fair to me that you're paying a fee to establish that relationship, and it's a one-time fee. It's not like a retainer in your practice. Okay. Um uh Erin and Susie, can you share some perspective on this question?
Sure.
Yeah, I think we also have the proactive planning is what we call it. And ideally, we do establish that relationship ahead of time, and everything that Heather was saying, understand what their wishes are. And that's just a quarterly visit, an initial visit and a quarterly visit. But we can at any point transition into active care management. If we have a client who's going to need surgery, we can help visit them in the hospital, coordinate the discharge, get to rehab if that's necessary. Do they need respite? Do they need home care? We can provide all of that, and that's all billed at an hourly rate.
And we have our Well Senior program. So there's an annual enrollment fee, and we visit our Well Seniors once a year. But like Heather and Erin, we have all of your information in our database. We had a couple who were Well Seniors, and the wife was a gourmet cook, and she needed a hip replacement. And so when she called to plan for her surgery, she was like, and we need gourmet meals delivered every day because I'm not going to be able to cook. And like, she knew she needed PT and all those other things, but the thing she was really focused on was that they were still going to be able to eat really well while she was recovering from her surgery. So I think that's the beauty of the programs that we each have, is when you're planning ahead and you have a resource that you can call on, they can help with everything from who would be a good physical therapist to gourmet meals, if that's what's really important to you.
Man, okay. Now, the incredible Gregory Hunter has a question that I've never had on these panels before. And one of you said something about having a long-term client. And Greg asks, how long would be considered a long-term client? I don't think I've ever asked a care manager. I'm kind of curious, go around the horn. What's the longest client relationship that each of you have had?
My very first client is still my client, 7.5 years.
Wow.
We have families that we've been working with now for 2 generations, so
Holy cow.
25 plus years, 30 years. One of the members of that family says, he just doesn't remember a time before Aging Well was in their lives, because we took care of his mom, his dad, his aunt, and now we're taking care of his brother and sister. So we have very long-term relationships with our clients.
That's great. Boy, Erin, I know the
That's hard
tough
to
acts to
follow.
follow there. Yeah, yeah.
You haven't even been in business for that long. I would say probably 8 years, but just as a really neat point, I started working with a woman in her mid-90s, and she's now 104. So you never know. You never know how long that relationship will go.
That's great. Okay, this is a good question, and I think it's a good question. It's your typical interview question. It's like, thanks for the list of things that you all do. What are some of the things that care managers don't do? And one thing I'm curious at how you'd answer this, but one of the things Susie was talking about to the person that asked this question is how they're incredibly networked. I call them the rock stars of senior living because everybody wants to be their friend. So when they stumble into things they can't do, but like I think it's a good question because expectations are very important. And so you know, when folks come to you, letting like, what are some of the things that you are very clear about that you're not doing? Actually, I, I'm going to shut up, I promise. But maybe talk about the client relationship as you lead into this. Is that just because if the kids are paying and the kids want mom and assisted living, what's your response to that one?
Yeah, that one comes up a lot. Our client is our client. We're always going to act and advise in the best interest of our client, no matter who is paying.
Well, the older adult.
Yeah,
The,
we have the financially responsible party, but the care recipient, that is, and we do run into that. I think that really the job of the care manager is to try to get everybody on the same page when the adult children have a plan that is maybe not in alignment with what the elders plan is, then we need to bring those two threads closer together. We don't give legal advice. We can help connect people with attorneys. We can help people have some context for some of the legal issues related to aging. But when we tell you you need to talk with an elder law attorney, you need to talk with an elder law attorney.
I think
Yes.
that's a really good point, Heather. Because a lot of people, when they may call us about mom or dad and we'll ask if they are power of attorney and they'll say, yeah, I'm the executor. And so they'll be like, great, so when mom dies, you'll be in charge. But while she's alive, are you power of attorney? And is it for medical or for financial? And those terms can be confusing. Sometimes you can have a power of attorney and the bank won't recognize it. Sometimes people will have power of attorney, they'll go to the bank and the bank will say you have to get guardianship. And that usually is not what's necessary if you have a correctly executed power of attorney. So we help you understand the terms and what they mean, but we're not lawyers.
I think if they can think of us as sort of that first call, we're the central hub. You know, whatever your questions or concerns may be, bring them to us. It may be something that we can handle, or like they were saying, if it is, let's say, a bill paying service or a legal service, or we don't have caregivers, you need caregivers. We'll connect you with those providers that we trust to, work well on behalf of our clients. We're not providing all those services, but please ask us these questions because we'll know somebody who is the right person, the proper person for any of those needs.
Okay. I'm looking at the clock. We got about 10 minutes left, and I've got a few really good questions that I want to address. But folks, throw stuff in, and remember, we do these every month. So if we don't get a question answered here, and then you can also reach out to all three of these folks. I'm putting their contact info. But Rita has a very heart-wrenching question here. She says, I have long-term care insurance with 90 days grace period, age 92 with stage 4 cancer. Long-term care's definition of not being able to do 2 of 5 activities of daily living is so restrictive. I struggle with 2 of them and can succeed, but I do not have someone standing by to help, which they demand, and I do not qualify. Any words of wisdom for Rita?
Well, I would ask if she's qualified for hospice, because a lot of times long-term care insurance companies will waive that elimination period if you are on hospice.
Hmm.
That would be one question that I would ask. And I think working with you to really take a close look at, they're not, when I look at somebody and can they do these activities of daily living? Like if I give you 4 hours, can you get dressed? Yes, but should it take 4 hours to get dressed? No. And so I think there's some choreography and strategizing that go with, and I see Erin and Heather nodding their heads when you're trying to get that claim approved by the long-term care insurance. And also speaking their language with their terms helps them a lot. So those are the kinds of ways that we help people with that. Erin, do you
Yeah,
have other thoughts
Rita,
on
I
that?
mean, as Susie said earlier, this policy is money on the table, and I really like the strategy of reaching out to an aging life care manager in your area. You might have to talk to a few of them just with this question here, and they may be able to help you unlock that policy, and provide you support in the interim too. Um, Holy cow. Okay, this is another question, and we can go back. Folks, jump. You can jump in if you've got things, but I really like this one because hear this one all the time. Are you or any of your staff in your organizations willing to serve as personal representatives or substitute trustees for estate management? Also, are any of you in the know or networked with others who might be willing to serve as a personal estate representative? These are individuals that might not have a proxy or healthcare power of attorney. What kind of guidance can you give to these folks?
There are practices who do it and do it really well. Our practice doesn't, but when someone reaches out to me with that need, I definitely have people to send them to in our region.
Okay.
And I also think that we don't provide, many of the daily money managers will provide that financial power of attorney. And that's a very good delineation of roles, I think. But often with our clients, we can help them determine who would be the best, let's say, healthcare power of attorney. In one case, we have a client here and her healthcare power of attorney daughter lives overseas. And that works well because we are sort of the in-person eyes and ears. She can still make that decision even though she's not local because we're here to provide information and communicate the wishes and let the medical providers know who is that proper person as the healthcare power of attorney. So it's always worth having a conversation because we've had good success identifying somebody who can do that. And as Heather said, there are other organizations where their primary job is to provide those services.
Great.
And we
Okay.
would never serve in a financial role with a client just because of the potential conflict of interest, but would refer people to other organizations or attorneys or folks who do that.
But I know all of your organizations could advocate and help manage, and if there is sort of conflict between the proxies, you know, you're there as a strong advocate. And so okay. Got a couple of great questions that I just saw, and hopefully we can address these. But one thing that we haven't really talked about is long distance assistance. And Wendy says, you know, if you had to plan ahead with someone who needs to move out of the area with no contacts, can you assist with resources for finding and transitioning to another state? And she's not referring this to generally being an institutional like assisted living move, but I know long distance caregiving is something that you all work a lot with, right?
These are always, I think, really fun cases to work on. And again, back to the Aging Life Care Association, we have a network of professionals all over the country. And so I love it when there's an opportunity to partner with a care manager in the state where we're moving to, and we do our piece and they do their piece, and then we get a beautiful seamless transition. So it's always fun when we get to work with a colleague on one of those interstate moves.
And I like Nicole Smith in the comments says that she always calls the aging life care manager the boots on the ground for the long distance person. And I agree totally. It's like having somebody that lives there and knows the language and what have you. Okay. I think this will probably be our last question here, but it's a doozy. But it's an important one. Burke says, could you provide guidance on the pros and cons of various home care agencies? And I'm curious, how y'all might answer that question.
Yeah, I saw that question, and I think the first question I would ask is, are we talking about home care or home health? So home health is that Medicare provider that would send a nurse or OT, PT, speech into your home. That's one group, and if you're covered by Medicare, you have your choice of providers, and depending on where you live, we can recommend a provider to you, and even may have a contact with that agency. In terms of home care, which is typically paid privately or by your long-term care insurance, where you need somebody to help get dressed and make your meals and personal care and meals and light housekeeping. We have, I would say, about 8 or 9 companies that we regularly refer to, and we're really looking for the right caregiver for you. And so we typically would suggest that you talk first to company X because they typically have that type of caregiver, or maybe you're looking for live-in. But if the first company that we call doesn't have the right fit for you, we just move on to a different company until we find the right fit, the right person for you.
And different home care companies are good at different things. I mean, I think because we work with so many of these partners, if all you need is 1 hour for a shower, we know what company does that, because a lot of them want at least 4 hours or not more. If you're looking for the lowest price point in town, we know who does that. If you like a really high customer service, lots of oversight, we know who does that. So it really is about assessing the need and the preferences of the folks that we're working with, and then tailoring some options that are best equipped to meet that need.
Right, and I would add that we know which agencies do the best job in each of the counties that we work in. And when we get a request for a caregiver for a client, we will call those agencies first. Find out, without sharing the name of our client, find out, who do you have available? What are your current hourly rates? Can you do a 10-hour or a 12-hour or a live-in? Collect all that information, then we provide that to our clients and their families. Okay, here's option A and option B. Here's why we think they're worth your consideration. And here are the strengths of each of those companies. Because we have, and I'm sure both Heather and Susie do also, probably 60 different home care companies in the greater Philadelphia area, and we have a handful that we trust.
Yeah.
So I think that's a benefit of working with someone in our role, is because we have such constant interaction with them. We know where to direct the clients.
And, one of the things in talking to so many folks that have used vendors, whether they be home care or not, with or without the support of an aging life care manager, the important thing to recognize is mistakes always happen. Caregivers might not show up. The instructions aren't followed quite the way that you want. But what I found is the individual that is doing that and managing that on their own, the family direct with the vendor, is not in nearly as good a position as the one that can now say, I just discovered that our home care aide did not show up. Can you handle this? And let me tell you, when that call comes from an aging life care manager, it gets their attention. Not that it doesn't get their attention from the customer, but I think, again, I call you guys the rock stars from the industry for a reason. Holy cow, we have burned through an hour. I can't believe, I think we did a pretty darn good job of answering all the questions that came in. And not to mention, I think we talked about a lot of the topics that we were huddling on that we wanted to cover today, but we did it in response to the questions instead of us doing the college lecture style presentation. Um, uh, so, and so anyways, thank you so much, y'all. You'll get a follow-up. The recording will be on the website. All of our panel members' contacts info will be there. Have a great day, everybody. And I want to thank all of our panel members for spending time with us.
Thanks, Steve.
Thanks,
Thanks,
Steve.
everybody, for attending. Appreciate
Yes.
it.